Hello, good evening, viewers, and welcome back. We are back on the Guyanese Critic page. We really missed a lot of our viewers, and thank you to all the viewers who came over on my page and Dr. SAWH's page just to watch, and you were watching the show with us and interacting. We really want to thank you so much for being there with us. But we're back on the Critics page, and this is where we meet most of the people with this platform. There is a lot of people following this platform, and it's the best platform to meet everyone. So good evening to you again. Welcome back to Ask Dr. SAWH, your favorite health show. Dr. SAWH, good evening.
Good evening, Akash. Yes.
How are you keeping, sir?
I'm doing all right. Yes, can't complain. We've got a nice, sunshine these days. So I'm quite happy about that.
Right. Well, we're always happy about sunshine. It's going to rain here. It's going to start raining here from what they're saying. But Dr. SAWH, just like the sun and the rain, there are so many different things that affect our bodies. There is a season, there's a season for rain and sun, but there is no season for sickness in our lives, and we should do the best we can to avoid being sick. So this evening we're talking about one of them, man, that I didn't reach to that stage, but it could have gone south, and we're talking about chronic kidney disease this evening. Doc, there is so much I want to talk to you about that, because I know a lot of people that I talk to, they tell me that they have symptoms of kidney stones, and I remember that when I had kidney stones, my kidney stone was bad. I had one that is about 10 mm. It was big. I saw every color that exists on the spectrum with pain, and we're talking about chronic kidney disease this evening. But how, Doc? I wanna. I remember having this conversation with my doctor back then, and he told me, he said, if you don't start look after this thing, it is going to become chronic kidney disease, and it leads to kidney failure, and then you got to go get all of these different transfusion. I was like, what? So, man, I want to ask you this evening, Doc, what is chronic kidney disease, and why is it important for us to touch on this subject?
Absolutely. Very good question. And just an inference from what you said about a season that sometimes is unpredictable.
Yes.
Well, with chronic kidney disease, there are two components. There is a predictable component, and there's an unpredictable component.
Right.
Just, put it in context. But let us talk what the definition. What is chronic kidney disease? As the word says, chronic means is there for a period of time.
Yes.
And kidney disease is, which is usually a permanent problem, is decrease in function of the kidney. So whatever it is causing a decrease or impairment of the kidney function, and by definition, it should be there for more than 3 months.
Right.
So let us define what is a function of the kidney. So if we say chronic kidney disease, we are saying that there is something that is causing the kidney to not to function well, and it has to be there at least for 3 months, and then we will define that as chronic kidney disease, and usually it's permanent. And I mean, the nature of it generally is it's a progressive disease that gets worse with time. And when we get into the causes, we'll talk a bit about that.
Permanent, you said?
But why is it important? I mean, lots of people think our kidney is just filtering the blood. As we know, we say the blood flows through the kidney filters it and purify the blood, take away all the bad, toxins from our body. But that is one aspect to it. So it filters the blood, importantly. It regulates the water balance, right? So when patients have kidney failure, for instance, they have retention of fluid. So if you have a failure, that's one of the functions of the kidney. Secondly, so I always, just to remember it, I can say, okay, let's think about the kidney has got 5 functions. So just for simplicity, for you to remember it, when we say a number, it tends to stick, longer. So we say it controls toxins and water balance. So it removes the toxin and water balance. It controls the electrolyte in our body. So electrolyte would be the salt in our body, potassium, sodium, and it controls the pH, that is the acidity of the body, of the blood. So that is very, very important. It helps to maintain blood pressure. that's a very significant function of the kidney. Sometimes we don't realize that. We think blood pressure is only to do with the heart, but the kidney helps to control the blood pressure by mechanism I will explain later. It also controls, help to maintain our blood count. Anemia, for instance, if your kidney is bad, you cannot produce red blood cell, and we talked about anemia in previous episodes. So that is 4. And the 5th one, it maintains or help to maintain the strength of our bones. So if we're saying that, okay, it's got those 5 fundamental roles and the kidney is damaged, then of course it will affect all those problems. It will have all impact on all those functions. And it is very important to grasp that point so that it is not just our water balance or our salt balance, but we're talking anemia. So when you look at it, it affects almost every part of our body. And yeah, so that's the why it is important. Let us put it in context in terms of the significance and the impact of chronic kidney disease. Mm-hmm. They say it affects about 37 million Americans.
Americans alone?
Now Americans alone. Globally, the stats is high. I don't have data on that, but when you look at the stats in America, they say it affects about 30 million. Wow. But here, what's the sad news? The sad news is over half of those patients don't even know that they have chronic kidney disease.
Wow.
So if you're talking about over half of those patients don't know, and when we talk about chronic kidney disease, I'll go through, there's some stages, but when it comes to the end stage is what we call end stage renal failure. And that's the stage when you need dialysis. And think about it. If you look at dialysis patients, if you have to go on dialysis, so let's say you don't do anything about your kidney and you go on to have dialysis, this 5-year survival rate is only about 40%. So more than half of the patients will die within 5 years. More than half of the patients will die within 5 years of having dialysis. And they say if you're over 65 and you start dialysis, you probably would last only about average survival is about 2 to 4 years. So it is not, the impact is really massive. It's $1 billion cost to economies, and it's very important. And the good news is it is easy to pick up, very, very easy. So when they define chronic kidney disease, it's 2 simple tests. 2 very simple tests will tell you, yes, you have chronic kidney disease. And so it is so easy to identify. And once it is identified, then of course you can look at ways of how do I prevent progression, what do I do to keep it at bay, to maintain it at that level so I don't end up into end-stage renal disease or dialysis. Mm-hmm. And lots of patients, I've got lots of people with chronic kidney disease that they've had it for 10, 20 years. But once we are in check with it, and once we are treating them aggressively to prevent further or rapid progression, they may die from another cause rather than their kidney. So not everything is a doomsday. It's that if an important thing, and I would plead to patients and the public, try to recognize chronic kidney disease and do something about it. Try to say, fine, I'm going to have some screening, I'm going to have some tests, I'm going to know my status.
So, but I mean, a couple of things struck me there, Doc. I never realized that there was that the kidney, one of the functions of the kidney has to do with our bones. I would like you to talk a little bit about that. And you talk about about the blood pressure. So a lot of people with hypertension, I know, would end up with chronic kidney disease. So I see a link there. But I mean, what I want to ask, Doc, you're saying that half of the 37 million people in America don't even know that they have this thing. So what can we do? How do we know we have it? Like, what tests can we carry out? Are there routine tests that we should do every year or every 2 year, 5 year? What should we do, Doc?
Fantastic. So yes, so first we would say it is so easy to identify just by doing a test. But how do we know we get it? So for us to have So they have stages of chronic kidney disease, stage 1 to 5, right? So obviously, when you have, like, if you have anemia and you have mild anemia, you probably wouldn't know because it's so mild. You don't have symptoms. But when you have severe anemia, you would start having symptoms. Likewise, if you have kidney disease and it is very mild or it's in stage 1, you might not know unless you have a test. So two things. Whenever you want to know if something, how do we know we have something? You can either say, fine, I have symptoms of that. So you will manifest signs and symptoms. And what are the signs and symptoms? Signs and symptoms would be, of course, you're tired, you feel fatigue, you may have nausea. So nausea, vomiting, you may have dry skin, you may have itchiness of the skin. You may have water retention, so swollen legs, puffy eyes. You feel, of course, you feel lethargic. Those are, signs and symptoms, but you tend to get in the latter stages of chronic kidney disease when the kidney is really going bad. In the beginning or the early stages, you don't have any signs and symptoms. So what you should do, you rely on a test, and a simple test. So we do annual blood tests. Generally, these are like your health check. So I would encourage everyone in the UK, for instance, over the age of 40, we do annual cardiovascular health screen. So these are well patients, don't know they have any problem, no symptoms whatsoever. They just go and say, Doc, I would like to have a health check, a checkup, sort of, right? Now, in that checkup, part of the panel of tests that you will do is called a kidney function test. And the kidney function test is measured by, so the two tests to define chronic kidney disease is something called the glomerular filtration rate, the EGFR. So E is estimated, GFR, glomerular filtration rate. And that is part of the kidney panel test that you're having. And we know commonly we use BUN and creatinine. So when you go to the doctor, they say your BUN, blood urea nitrogen, is high. It means something is wrong. Your kidney is not filtering that urea. And then you have creatinine is another function where it's the byproduct of metabolism, and your kidney meant to filter those things. So if they build up in the blood, it will raise the level in the blood. But we use those, the creatinine, to calculate something called the filtration rate of the kidney. And that is a little bit more, more objective to diagnose chronic kidney disease. So everyone should know what is their glomerular GFR. They should know what is their glomerular filtration rate. And the other test you do is a urine test. And the urine test is to see the early sign of chronic kidney disease, you start getting protein in your urine. So you can test for that protein, and there's a value you look for. So if you're testing for protein and you see there's protein are not supposed to be in the urine, you said, hey, there's some signs of kidney disease. Or if the filtration rate, so when we look at the blood filters through the kidney, and there should be a rate of filtration. And that is where you measure. So those two simple tests, the estimated glomerular filtration rate and the protein, the urine test for protein, if you have those two tests, you can say, and they're abnormal, so it shows that the kidney is not functioning well, you say that is chronic kidney disease. So just quickly, the filtration rate should be greater than 90%. If it is greater than 90% and you have other signs like protein in the urine, you could say that is stage 1. Just for simplicity to remember it, I tend to do greater than 90%, then you have 60 to 90, stage 2, 30 to 60, but of course it's not 30 to 60, it's like 30 to 59. But just for remembrance, you say greater than 90, 60 to 90, 30 to 60, 15 to 30, and under 15. It's easy to remember. So if you say your filtration rate is greater than 90, that's stage 1, between 60 and 90, stage 2, between 30 and 60, stage 3, between 15 and 30, stage 4, under 15, stage 5. Now, stage 5, we will call that end stage kidney failure or end stage renal failure. And that's the stage when we start to prepare you for dialysis. That's when we know, hey, kidney stopped working and you may have to go on dialysis. So they'll start preparing you for that, or looking for transplant if there was, a donor or so. But what are the common, you said about high blood pressure. Commonly, the most common cause for chronic kidney disease combine blood pressure and diabetes.
Yes.
So diabetes and high blood pressure account for the majority of cases of chronic kidney disease. And you and I know those two conditions, again, you don't have signs, symptoms generally, it's when it's bad. But of course, you can test for that. And they're simple tests. You have your sugar test, you have your blood pressure check. If we know that 3/4 of the patients, that's what they have got, their kidney is damaged due to that, let us look at ways of identifying that and treat that. And of course, look for the kidney, see if it's damaged, and look for ways of managing it.
Right.
So I think that's it. The other causes, so coming to causes, so diabetes and hypertension would be the bulk of the causes. And then, of course, there are some conditions where the body attacks the kidney. So glomerulonephritis, we call it. And these are immunologic conditions where the kidney has got a filtering system. So it's got a blood vessel, blood flows in that, it filters, it collects into a capsule, and then that drains to the bladder, and then you pee it out. So if that whole system, we call it a nephron of the kidney, is damaged, so there's the glomerulonephritis can cause damage to that. And of course, you mentioned kidney stones. Kidney stones, if there's a blockage of the kidney, think about it. The urine meant to flow, there's a blockage, there's a buildup of pressure.
Right.
You have a backflow. What happens when the backflow goes? It swells the kidney because it can't come. It's not coming out. It swells the kidney. You damage the nephrons. That is the small vessels in the kidney. You can get kidney failure. You have infection. You get pyelonephritis. An infection just takes over the whole kidney, damage the kidney. You have certain medication, drugs like ibuprofen, family of drugs. We call it NSAIDs.
Yes.
They can damage the kidney. And you have something called autoimmune disease where the body attacks. I talk about glomerulonephritis, but there are other autoimmune disease like lupus. You must have heard of lupus.
Yes, of course. Yes, lupus. Yes.
Yeah. Now, these are your causes, but let us focus primarily on diabetes and hypertension as the biggest, causes, and how do we, manage patients like that? What do we do? How do we, that's the whole point of identifying early and treating.
Yeah, but Doc, you mentioned earlier a couple of symptoms that you can look for, and then you went on to describe that you're going to go through these stage. You reach end stage, which is stage 5. What are some of the major before I talked about treatment? I want to know what are some of the major complications that, well, obviously I know people who have died after going through dialysis for a while. I mean, that's the end game. It's unfortunate, but what are some of the major complications that can arrive? Could someone suffer a heart attack because of kidney failure? What are some of the major complications?
100%, of course. You could get heart failure and as a result of chronic kidney disease and heart attack. So usually, so when we look at the function, I said to you that the kidney process your mineral and your electrolytes. So patients with chronic kidney disease, they have higher risk of stroke and heart attack by far. That is why in the management, you have to identify those patients early and give them preventative medication. So when I talk about treatment, I'll tell you, statin is an important part of the management. But what happens, because your electrolyte and calcium, they're not properly managed, you can have calcium deposits. So calcium can get into the blood vessel where it hardens and thickens the blood vessel. So if you have calcification, so we call that calcification of the blood vessel, you have increased risk of arteriosclerosis, that is buildup of plaque into the blood vessel, and you have a heart attack and you have a stroke. So complications are important. So just let us go back to function and you'll see complication. So if we say you're having control of water and salt. If you have a damage of water and salt, you have a buildup of water in the body. So you have fluid in the lungs. You have strain of the heart. You can have fluid around the heart. So buildup of fluid, that's one. the electrolytes. So you have the body, the kidney controls something, especially potassium. There's electrolyte, a salt, that is called potassium. If that potassium goes high, you can have a heart attack. Well, you get what is called arrhythmia.
Right.
And that's a medical emergency. So when our potassium meant to be very strictly controlled in the blood, if the potassium goes very high, your heart goes into an irregular rhythm and you have a cardiac arrest. Just stops, the heart stops. You get something called ventricular fibrillation, and that's the end of the heart. And you die. So it can have fatal consequences. You can have uncontrolled high blood pressure, hypertensive emergency if the kidney just back up. You can have something called acidosis. So again, the kidney got to control the acid balance in the body.
pH, yeah.
So complications, you have acidosis. And importantly, we talk about bone. I told you function.
Yes, I want to. Yeah, tell me about this. Yes.
So the kidney controls. It activates vitamin D. So we know vitamin D is needed for bone calcium metabolism. Right? We talked about. We know if you don't get enough sunshine, your bone gets weak. Why sunshine is important? Sunshine is important because it makes vitamin D, and vitamin D is needed for calcium absorption, and it enhances bone strength. So what happened in the kidney? The kidney has to convert vitamin D to an active form. That's the role of the kidney. It converts, so we say it activates vitamin D. So if you don't have, your kidney is not working well, the vitamin D is not activated, so you have poor calcium and you have dissolution of the bone. The bone weaken, so the bone starts to lose its strength. Then also the kidney has to regulate phosphorus. And if the phosphorus builds up, it again causes thickening of blood vessels, and you have a whole electrolyte abnormality and mineral abnormality in the body. So it is, and those are the complications. It's very, very significant. So the kidney is a big one.
Doc, the human body is truly fascinating. I mean, when you look at this one little organ that does so many different things and control, that it even has to activate the vitamin D in order for it to become what it has to be to function the way it's supposed to function in the body. It is so amazing what, you know, this human body. I'm always fascinated by it when you explain these things and how these things function at such a minute level. And without this, as you rightly said, if the kidney packs up, we're gone. You know, if this kidney decide that I'm done, we're done. You know.
Absolutely, and anemia. I forgot to mention anemia as well, because the kidney also produces something called erythropoietin, and which cause production of red blood cell. And that is why even patients with kidney disease or who are having dialysis, you will notice they have regular injection of that erythropoietin because the kidney cannot produce it. So if you don't have that chemical in your body, you can't make red blood cell. So you become anemic, and that is significant. Yeah. So those are the complications. So we can't overemphasize the importance of kidney function.
All right. Well, Doc, since we have about 5 minutes more to go on the show. We're going to try to keep it tight tonight, half an hour, because we're now back on this platform. So next week we're going to get questions. And remember, viewers, please send in your questions. We'll be answering them next. We'll be answering those questions next week on if it's not on the subject of kidney disease, then you can send in your questions on any disease. Doc, we got 5 minutes, man. Just tell me about treatment. Tell me about treatment. I really want to know about treatment.
No, absolutely. So again, I want patients to remember, and I want everyone to remember this. Let's say, I would say for memory, let us say 5 things you need to do. Let's just put it in that way. 5 things. I mean, of course, I can join them up, but I just want to say, remember 5 things we do. 1, you want to know what are the causes of your kidney problem. Look at that and address that. So first thing, let us address the causes. So I said diabetes and hypertension, those are big causes. So let us address that importantly. Ensure your blood pressure is controlled. Ensure your diabetes is well controlled. Now, just for patient, just a recap, I want your sugar to be, we look at the average sugar over 3 months. We want it to be not more than 7. This is called 7% your HbA1c. So it's important to get that down. We want your blood pressure. I want it under 130/80. So most patients, we say 140/90 blood pressure under that is normal if it is over 140/90. But in patients with high-risk patients, I want it 10 lower. So I want you not more than 130. I want you not more than 80. Remember that. So we want to control those things that we can control because they're the cause for the damage to the kidney. Now, this is very, very fundamental and important. So so we have done a blood test. We know you've got CKD now. So you have chronic kidney disease. I want every patient who have been diagnosed with chronic kidney disease, I want them to ask their doctor, Doc, what are the tablets I can take to prevent progression? So let us get this important point. Chronic kidney disease is not reversible.
Yeah. You told me that, man. That's shocking.
It's damaged totally.
Wow.
So what we have to do, we have to slow the progression. So how do we slow the progression? At this point in time, there are only 3 drugs on the market. 3 drugs. When we talk about intervention.
Yes.
So there are only 3 drugs we want that is on the market that is proven to reduce 3 classes of drug. Let's redefine this.
Yes.
3 classes of drugs. And each class have got a few.
Yes.
So 3 classes of drug. First class is a drug for blood pressure, but even though your blood pressure is normal, I would give you a drug. They are called ACE inhibitors or ARBs, right? So they are intentionally, the first use for those drugs are usually for blood pressure. But the evidence have shown that these drugs, they slow the progression of chronic kidney disease.
Okay.
So everyone, even though your blood pressure is controlled, if you have signs of reduced kidney function and you have protein in your urine, the doctor will usually give you an ARB or ACE inhibitor to prevent progression. Now, of course, the doctor will see if that is appropriate for you, but as one. The second drug, it's a newer drug that came out in the past few years, over the 5 years, but it's relatively new. When I was trained, it wasn't on the market. Now, of course, it's on the market. It's a diabetic drug. So think about it. First, I said there's a blood pressure drug to slow the progression.
Right.
Now there's a diabetic drug to slow the progression.
Yeah.
So even though you don't have diabetes, the drug is also licensed for chronic kidney disease. And it's a new drug called it's a family of drugs called SGLT2 inhibitors.
Okay.
So generally these drugs, they work by allowing your kidney to filter out the sugar in your body. But the evidence have shown that it reduces proteinuria. So when you have protein in the urine with chronic kidney disease, we will normally give you SGLT2 inhibitors to prevent progression of kidney disease. And the third drug that we have is called mineral corticoid, MRA, mineral corticoid receptor antagonists. So there are some chemicals in the body that cause your body to keep salt and water, and you want to block those effects. And also it causes increased inflammation. So by blocking the effects of inflammation on the kidney, they help. And there are a couple of drugs, finerenone, eplerenone. These are the family of drugs they call MRA. So if you remember these 3 drugs, and anyone who have got chronic kidney disease identified by their doctors, they should say, Doc, am I eligible for these 3 drugs that the doctor talked about? And then the doctor would say, fair enough, yes, we've seen that, and we'll give you that. Now, the other thing I said, 5 things you want to do. So you want to treat the underlying cause, you want to treat that, you want to then look at drugs to prevent. So patients with chronic kidney disease, they die from heart attack, they have higher risk of heart attack and stroke, so you want to treat that. And how do we prevent that? Again, we look at risk factors. What are the risk factors? Cholesterol, so we want to control the cholesterol. We normally give all patients with chronic kidney disease, we also give them a statin. The fourth thing you want to do, you want to treat complications. So if you have complications like your potassium is high, there are drugs we can give. If your potassium is high, your phosphorus, the minerals are high, we have what we call binders, mineral binders, that you can take. It binds with the mineral and you excrete it. So they are called mineral binders. So you treat, or if you get water retention, you may want to use some diuretics to get rid of the water. So there are all those, treating the complication. And the most important thing is that you do not want to cause damage. So you do things to prevent damage to the kidney. And what are the things to prevent damages? You want to avoid, there's a class of drug, very important, NSAIDs, that is non-steroidal anti-inflammatory, of a family that we know of, is called ibuprofen. So in Guyana, I mean, across the board, I mean, the world, patients take painkillers nilly-willy.
Yeah, that's right. Yeah. Any little thing.
And they just buy paracetamol, ibuprofen, diclofenac, whatever it is. I would say to anyone with chronic kidney disease, please do not use NSAIDs unless absolutely indicated and only by guidance of a doctor, because these drugs are known to cause harm to the kidney. So ibuprofen, diclofenac, if your kidney is bad, do not use it. Also, there are some other drugs we will look at, like diuretics. You got to be careful when you're using it. And also, if you have some blood pressure tablet, you'll be careful so that you're monitored by the doctor. We will normally do frequent monitoring. And your lifestyle is very important. So just 2 minutes.
Yeah, that's right. Yeah.
Lifestyle.
Yeah, talk about diet in the process also, Doc.
Yeah, a diet and lifestyle. So the diet, there isn't. So what we'll do, if your kidney is bad already, and I said your kidney is having a problem controlling the salt, electrolytes like phosphorus and potassium, you would want diet that is low in phosphorus. So your meat and organ meat, they're high in phosphorus. You want to decrease that. Dairy products are high in phosphorus. You want to decrease that. Potassium, they're also, you want the diet that is low in potassium. The evidence, lots of people worried about protein. Protein, generally, there's no, our guidance in National Institute of Clinical Excellence did not say we should go on low protein diet. You should eat a normal protein diet, but what I would want to say, do not eat excessive protein. So, some people go on ketogenic diet and things like that. I would say no to that if you have chronic kidney disease, because byproduct of metabolism, it puts more strain on the kidney. You want a high fiber diet, and of course your fruits and vegetables. So that's your dietary thing. You want to reduce, you want to exercise. Guidance would say 150 minutes a week of exercise is a recommended healthy living exercise. You want to stop smoking. Of course, smoking causes more harm to the kidney and blood vessel. Right. You want to stop smoking. You want to hydrate yourself well. So you keep your body well hydrated. So dehydration can cause kidney damage. That is your kidney treatment in a nutshell.
Well, thank you so much, Doc. Thank you so much tonight. I mean, as I said, this topic is kind of close to me because I could have been at this stage had I not, got my kidney stones looked after. And, thank you so much for this information tonight. Viewers, thank you so much for joining us. As I said, we're back on the platform. And I want you to continue to send in your questions because myself and Dr. SAWH, we're going to be addressing those questions to you next week. So even if you joined the show late, please send in the questions. Send in your questions now, and we are going to be dealing with those questions next week. Anything you want to say in closing, Doc?
No, I cannot I want to say thank you to the viewers, but quickly, I just cannot overemphasize the point. Every patient, everyone should find out if they have chronic kidney disease, and please, that should be like how we are worried about our diabetes and high blood pressure. Think chronic kidney disease.
All right.
We save lives.
Good. Great. Viewers, thank you so much for joining us. Wonderful opportunity to present this information to you. Send your questions in and share this with everybody. Have a wonderful night, and can't wait to see you next week and answer your questions. Anything in closing to you, Doc?
Thank you. Thanks again to everyone. Good night.
All right. Good. See you next week.